Why worry about the psychological side of OHS? Why worry about the whole psychological side of workplace injury and that sort of thing? Well, if you look at the public sector environment, in 2004, the cost of an average psychological injury claim was $106,000. The cost of a physical injury claim was 15 grand. So it's much cheaper to get hurt physically than what it was to have a psychological injury. Now, if this is what's happening in an office environment, imagine what the costs are when you're talking about someone who's working in a hostile and remote environment. When you're talking about people working in an office environment, if they've got the willies with somebody, they might be able to go home that afternoon. In a hostile remote area, you can't do that. The cost of these sorts of things in a hostile or remote environment are also going to be amplified by the fact that it might cost you $4,000 and 2.5 days travel just to get there. So there's no quick escape as what there is in some of the more corporate type of environments. So if we want to have a look at the things that actually come together to impact the level of risk that's inherent in any work environment, it's not just the workplace, it's individual factors as well. But there are a number of key things, in particular with hostile and remote environments, that really do add to the level of psychological risk to people and to the employer as well. Number one is just quite simply the environment. There's a reason why they call them hostile environments. They're not that friendly. The level of risk is much, much higher. Added to that, you're talking about people who are quite often around, like in the security sense, firearms, in the mining sense, big machinery, construction, big machinery as well. What we find there is when people's psychological well-being is compromised, accidents happen, there's big OHS issues that go on as well, and there's a lot higher level of just physical risk in those environments. The high level of physical risk in those environments therefore leads to a high level of psychological risk just because the chances of trauma are much higher. The chances of people in those environments seeing something catastrophic are much higher than people working in a normal office place, bar someone coming in and having a heart attack in the hallway, which does happen. A couple of other things in the workplace that really do confound the level of risk that's there is the social environment of the workplace. We're going to look a little bit closer at some of the people who work in these areas, and you'll see that they're not necessarily the touchiest, feeliest people out there. The type of work environments and the social structures within those environments do make a difference to people's willingness to actually seek assistance, their willingness to actually put their hand up and say, hey, I'm not doing too well today. And so there's a couple of very key things and key lessons that can be learned there. And the cultural environment, this is something that I found talking to people who work in a lot of the humanitarian and aid areas. For some people who go into those particular sorts of roles, just not being aware or fully informed of the sorts of things they can expect at a cultural level, things they're expected to see, things they're expected to do, or the extent that their contribution is actually going to be meaningful, can have a really big impact on somebody's sense of self-worth. But very easy for us to actually influence, and some of the most critical variables for looking at what contributes to risk factors are the systems and processes within organisations. Three things really stand out for me. One is the level of preparedness an organisation has for when things go wrong. And I never cease to be amazed just how poor some organisations are at that sort of thing. They're fantastic at putting people in harm's way, but not real great at actually making sure that someone either knows what the response protocol is, or that somebody's adequately prepared for being there. Some of the risk strategies, what are the more holistic risk strategies people are using, and what are the actual critical incident protocols people have in place, because there's a lot of really archaic things out there. Going back to the fun side of things, let's look at the people. Who is it that works in these hostile and remote environments? Who is the person that does fly in, fly out to a mine in Western Australia, does fly in, fly out to Afghanistan or Iraq as private security? Who are the people who do the war journalist roles? Who are the people who are attracted to these type of professions? They tend to be people with a fairly high tolerance of risk. They tend to be people who are somewhat high on the sensation-seeking side of things. Those people are not the same group of people who typically have a really high level of access to mental health services. They're not going to self-select to go and see a counsellor necessarily every Friday just to make sure they're doing okay. So this is a really interesting thing that we've got to give consideration to when we look at these particular sorts of people, because they're not necessarily going to be as willing to be accessing services that people in a standard office environment might actually be willing to do. There's not a lot of self-care involved with some of these people. Another fact of people working in these areas is it's very biased towards the male gender. There are females that work in private security and mining and construction, all those sorts of things, but there is a bias towards males. One of the bits of research that's come out again and again and again is guess who's least likely to access an EAP and psychological support system? Blokes. Yeah. So this has big impact on an organisation's risk strategies when they think, okay, well, what have you got put in place? If you're relying on just having an EAP model for people who work in these types of environments, guess what? It's not going to get a great deal of utilisation. It probably won't cost you a hell of a lot. You probably won't have to have too much utilisation rate of that, but you're not going to be accessing these services too much. Another thing that I've found working with people in these environments as well is they're not necessarily the most psychologically aware. This is not a criticism of them, this is just not part of their general makeup and personality. And I am talking in very much generalities here. They are really good at telling you how long they can have their last beer before the urine test. They're great at those sorts of things, but they're not that astute when you go to ask them, okay, what's the safe level of drinking? What's the safe level of drug use? And those sorts of things. So these are things that come together to make it a little bit trickier in how do we actually manage the psychological well-being of people who work in these types of areas. And a lot of that comes down to the sorts of workplace policies and procedures and practices that we put in place to help cover off this sort of stuff. So I'm going to touch on now, but just mitigating risk. What can we actually do and where is it that I've seen things go wrong? And I'd like to punctuate this with a couple of examples and anecdotes I've come across over the last few years. Okay, what can we do about the physical environment? Not a hell of a lot. Education is a really good thing that we can do there, make sure people know what they're getting themselves into. There's a really good reason. Does everyone know a place called Marble Bath? Do you know why you get such a huge bonus if you stay 18 months? No one stays 18 months. It's like literally $100,000 for some people if they stay for an 18-month rotation. I don't know if they've ever had to pay it because it's just so hot and so miserable out there, people don't go. Cultural awareness programs and things, there's a lot of these sorts of things around we can actually do to help people prepare for working in these areas. Even if it's stuff around working in multicultural teams. We're bringing a lot of foreign workers into different areas. We need to be mindful of those sorts of things and make sure that we've got strategies in place to help manage that sort of stuff in the workplace. Because the last thing we want is a whole lot of conflict. Okay, but one of the main things that I think we can do, and we're to have an influence on positively managing psych risks, is looking at the workplace culture. Workplace culture has a really big impact on people's willingness to seek support, willingness to access support services, and willingness just to stick their hand up and admit that there might be a bit of a problem going on. I think it's also critical that we start to really promote personal responsibility for people working in not just hostile remote areas, but all areas. It's their responsibility to take care of and look after their own emotional well-being as much as it is the employers to provide a safe working environment for them.